Any other therapies that you have seen to complement biomagnetic therapy?
Well, those are the two primary ones that we have here at our office. Also I'm a musician, so I started incorporating that a little while. But um, I mean, there is something, and it's a system that I developed. Biomagnetism for the layperson. And but that's my mission, is to empower people to be self-sufficient. And I think that's very important because, a lot of people come, hey, you help me, you fix me. But there are things about each person is unique. And there's certain work that can only happen by you submitting yourself to your own personal work. So there's this, what I call the recalibration system, where I submit people through a protocol of magnets and a self-awareness intake. And the people that do submit themselves to that learn a lot about themselves and come out with an awakening, if you will, having gone through that experience.
Can you go into that a little bit? Because, I guess a question that we've received also is, well, why can't I just do this at home? And there is an art almost to say, and a medical expertise area of this, to know where the pairs go, to know how to utilize them for the right times, whether you're using more muscle testing, bioenergetics, bioresonance testing to choose where it is. And as things start to correct, or the layers of the onion peel, you have to go somewhere else, right? So that is where you require possibly a practitioner to assist you with that, as opposed to just throwing magnets anywhere on you and expecting that to work. But I like that idea of empowering someone to still utilize it outside of the medical arena or professional arena. So go into that a little bit more. What can people do to start utilizing biomagnetism themselves?
Absolutely. I want to share this with you. A couple years ago, when my son was, I want to say 18 months, he's got a little sniffles and he's coughing, and that's fine. Let his body do what it's going to do. And I'm not that type of parent that's like, oh my God, a little booger, and let's do therapy. No, let's just see what his body does. That's completely fine and normal. And as the day goes on, so here we are, and he has dinner, but now he's coughing more. And then it just seems like, oh, now he's going through a little bit of a crisis because he coughed so hard, he vomited. Now at that point, now it's like, okay, now it's magnet time. And it was a beautiful thing to see him, like, from looking completely stressed out, in fear, crying. And after like 5 minutes of having magnets on his body, he cheers up, and then he starts running around all over the place, like if it was daylight all over again. Like he just got super energized, and those symptoms went down like a lot. And I was just, that was that moment in my life where I thought of all the miserable pain and suffering that billions of people in this world are facing. Because it doesn't matter if you're healthy, someone, a friend, a family member that's suffering, and no one's immune to witnessing suffering. And at that moment, I had never thought of what I do. The way I thought about suffering in that moment was like, it's not good enough that I have a little wellness. That's not good enough. We need to get magnets, and we need to put them in people's homes and people's hands. People need to start using this for themselves. And so I really started, getting the wheels turning there. And I started thinking, well, how do you deliver that? How do you show people that? Especially, seriously, I have these magnets that we sell as little kids. They're labeled positive, and the other side is labeled negative. I have people ask me, when they have it in their hands, which side is positive and which side is negative. And I'm just like, okay, so how do you factor that in? That people understand life differently, the way they feel about their own learning process. Some people are super confident, they'll look at this and say, no problem, I get it. And other people overcomplicate it, even though it's intended to be simple. My idea was that a 10-year-old should be able to pick up these instructions and make sense of them. And everything I've ever written, and Thank you for having that book. You can see that it's very simple to read. I don't try to get fancy because then you lose people and
Hmm.
people get paralyzed and do nothing.
Yep.
So that's what it was. The recalibration system was about showing people in a holistic approach, how do you look at your life? What's bothering you emotionally? What's bothering you physically? What's bothering you spiritually? Right? So that's easy. Most people are able to identify what bothers you. And so from there, the idea is that we form a bridge. Okay, well, where do you want to be? If you weren't sad, what would you rather be? If you didn't have back pain, how would that alter your life? How would that be differently? So, the easy thing is you have optimal physical fitness, or you say, yeah, go dancing or skating or hiking the way I used to. And then spiritually, you have to identify those things that are weighing us down. And in a perfect world, if it was in harmony, well, what does that look like? So now we've identified the problem and the potential solution. And then we take those elements and then we apply magnets. So there's a formula for the emotional challenges, like the sadness, for example, and that's it. That's all you think about. You lay there and there's a specific formula for that. And then the next day we address something else, and we do that for 6 days. And a lot of people get so much out of that. And see, you don't have to now diagnose virus, bacteria, fungus, that's what I do. And a lot of people get some phenomenal results going about it that way.
That's really cool because I always say a patient has to realize that as much as they could go into a medical facility and get treatment, they may be there 1, 2 hours a week. There is a lot of time and a lot of things they can be doing to healing outside of those 1 or 2 hours. Not everything rests on just being in a medical treatment facility or with a professional to heal. Healing is, something that comes from within. The doctor or practitioner never heals you. You heal yourself. They just help you, right? They're guiding you. They're your coach through it. Yes, they help to facilitate it. Now, something really interesting I heard there was, we recognize that biomagnetism could be wonderful for pain, as you mentioned, and for infectious disease. We see a lot of Lyme patients, and a lot of times biomagnets show up in their treatment protocols that are personalized to them.